You are responsible for your health, but what if someone else was too? From your dental health, digestive health, and your overall health coordination. Well, this is where the term care coordination is coined. In South Africa, it's common for people to have a primary care physician who they see for overall care. But beyond that, the goal of modern healthcare is to improve health outcomes at a reduced cost. In today's Health Matters, we look at the importance of centralized care. We all know that medical care can be very expensive, but one important way of reducing these costs is through centralization. That's the restructuring of healthcare services into fewer, more specialized divisions, which can significantly lower those costs.
So care coordination is a process whereby healthcare professionals are working together to deliver care to a patient. We have something that is very common and a huge problem in our society, which is fragmented care, where healthcare professionals are practicing in isolation. And not only does this result in really poor management of the patient overall, it really increases the costs of care, unnecessarily so.
This would need the comprehensive engagement of all those in charge of a particular patient, from determining the patient's needs and goals to a proactive care plan. Monitoring and having your primary care doctor at the center of this ensures that all treatments, goals, and medical processes are carefully managed to ensure efficiency, avoidance of disjointed medical care, and certainly unnecessary expensive procedures.
Members often just choose option based on what's the cheapest, or what is the one that my friend has recommended, instead of actually going through the benefit brochure, understanding exactly what it is that you're basically signing up for, because you're choosing this option and you basically will be held up to the rules of that option. So the problem that we find is that we have two options that are based on care coordination. The other options, really, you have the freedom of choice in terms of how you access care. The problem that we find, the biggest challenge, is when people opt for care coordination option, but they don't understand the rules. Now, what that leads to is frustration. They end up incurring penalties because they are not following the rules of the option that they have opted for. Then they end up spending a lot of money out of pocket because they are penalized for them, for example, not directly going to the specialist and going to the GP for a referral letter, or not using a network specialist.
Depending on the needs of the patient, there are two ways to approach this. Broad care coordination, which includes teamwork, care management, medication management, health information technology, patient-centered medical home care, and specific care coordination activities, which include establishing accountability and agreeing on responsibility, communicating or sharing knowledge, helping with transitions of care, assessing patient needs and goals, creating a proactive care plan, monitoring and follow-up, including responding to changes in a patient's needs, supporting patients' self-management goals, linking to community resources, working to align resources with patient and population needs. So now that we know why care coordination is important, how do we actually get it done?
Various healthcare professionals would be involved in the care coordination process. Really, the important aspect is that the patient's journey and this patient's condition is looked at holistically. Various healthcare professionals will be required. So it would be the primary care provider, then it would be a specialist, then it would be an allied healthcare professional, like a dietitian, audiologist, physiotherapist, for example. So anyone that is needed in the care cycle of that patient.
The benefits of centralized care clearly outweigh the costs of it. So it is best to stick to one primary care physician who will guide you through your medical care requirements, and it will definitely save you a lot of time, money, and frustration.